So really pleased to be here. Thanks so much for Nick for having me, and it's great to be with these other panelists who are real leaders in the field. So I'm going to talk about, I'm going to quickly go through in my 8 to 10 minutes some 4 or 5 different policy evaluations and policy-related research topics we've done, and then give a few of my overall thoughts as well. One thing we've done is evaluated calorie labeling, both in New York City and also in Philadelphia, and lots of other folks have done this as well. I think the take-home message here is that there is a subset of people who are seeing or using this information, and it's not everyone. It hasn't thus far proven to be a large-scale population-level solution, but there are some subset of folks who actually do use this stuff. And I think the question is, what's that going to look like longer term, and what's it going to look like as we combine some of this information with other sort of policy-related initiatives? So that's sort of one thing that we've done a fair amount of work on. We're doing some further work now to try to get a better sense of who are these people that are really using it, and are they people who are more nutrition inclined to begin with? Are they the populations or subsets of folks that we would imagine and we would like to see? And I think that'll be some illuminating work. Fresh food financing initiatives, other folks have mentioned this as well. These are initiatives that bring full-scale grocery stores to quote-unquote high-need areas, and we studied one that you see here in Morrisania in the South Bronx. It's funded by the Food Retail Expansion to Support Health Initiative by the Department of Health and the Department of City Planning and others. These are initiatives that give tax credits and zoning credits to supermarkets to site in these areas. We did some street intercept before and after sort of with a comparison group here. And I think one really interesting thing that came out of this is 90% of people, even at baseline and even in the comparison communities, are telling us they already shop at supermarkets at some level for most of their groceries. Now, we don't know how good these supermarkets are. We don't know necessarily what they're purchasing there, but they are at kind of at baseline shopping at some of these places. So I think that's an interesting thing for us to think about as we consider access sort of initiatives. And people are seeing this. So about a third of the folks, when you look at the neighborhood Morrisania as a whole, don't zone into the area right around the supermarket, but the neighborhood as a whole, about a third of the people are saying they kind of knew this new supermarket was there. What we didn't find, again, in our street intercept survey, for the community as a whole, and any real change in healthy food consumption or unhealthy food consumption, right? You imagine that these supermarkets bringing in some healthy stuff and also some of this less healthy stuff, and so we looked at both of those things. What we haven't yet done, and what we're doing now, is zoning in on the area directly around the supermarket to see if there's sort of differential changes for folks that live closer versus farther away, and I think we might potentially see something different there. We only looked at one slice of this, what happens to food choice. There's lots of other reasons you might like these supermarkets. Economic development, people are getting healthier stuff, maybe it changes the price of things as well. And so those are some other outcomes we're going to hope to look at in future work. The sugary beverage portion cap. So we did a couple different things on this. One is we did used some of our prior labeling data to look at what might happen, right? What might happen if this went into effect? And what if, on the left-hand side, everyone who purchased more than 16 ounces shifted down, and everyone else doubled up, right? And if we look at if 100% of people made the more healthful choice and no one made the more healthful choice and everyone sort of doubled up to 32 ounces. And we found that under most cases, most states of the world here, up until about 20 or 30%, this is a policy that could save people calories. And so that was some work that we tried to do just to kind of inform the policy as it was moving through the process that we could use with data that we've already collected. The other thing that we're doing right now, and work funded partly by Jacqueline and the New York State Health Foundation, is doing, again, some evaluation of the policy such that it actually does get implemented. And it's still moving its way through the courts, and I think it's still to be determined there. And so we're doing, again, some before and after with a comparison group data collection, both point of purchase stuff, as well as some dietary recalls, and also looking at the food environment to see actually how the food environment might be changing as a result of some of these policies. So that's some ongoing work we hope we get to keep doing. We also, as opposed to just some evaluation stuff, have tried some policy development field experiment sort of things. And we tried 2 different things in the study I'm going to tell you about very quickly. One is we tried taxes, right? Just sort of a policy tool that many folks have talked about and we don't have a lot of experimental evidence on. And the other thing we tried here is kind of a different way of labeling. So we set up what looked sort of like a bodega corner store sort of thing, actually in Bellevue Hospital in the clinical waiting areas there, where lots of people are, for better or for worse, milling about. And we looked at what they purchased was really what we did. And we tried a whole different set of experimental conditions. The labeling conditions was just this big red, less healthy sign. So you don't need to be numerate. You don't need to know what calories are. All you have to do is kind of look at that label. And then we also tried various pricing conditions. And in fact, our tax rate here was 30%, so pretty high compared to what's generally been talked about, which is generally in the 10% range. And we tried a couple different behavioral economics inspired ways to frame the taxes. We tried to break down the tax for people, show people why it's there. The moral of the story is that the taxes worked, about 26% increase in purchasing a healthier item. item. Our fancy behavioral economics framings that we know work in non-health fields weren't so influential here. That sort of the tax was the tax was the tax. The price mattered. It didn't matter how you differentially framed that tax. And the labeling mattered as well, as we did it here. As compared to some of our work on calorie labeling, you also just putting that label on saw a 15% increase in purchasing a healthier item. And so I think this is illuminating to start to get at the relative effect of some of these policies and the effect of them potentially together. What we didn't find necessarily, when you think about it, is, divide that 26% by 3, which is sort of more applicable to a standard tax rate, and some of these labeling things start looking equally, if not more effective than some of the taxes. Great. A different way to think about labeling, but one that we did find some evidence for it working to support more healthful choices. Some new work that I'm sure Andrew will talk a little bit about as well that we're doing is what about the sort of larger look at the food environment on kids' BMI? And so, it's actually quite hard to get the kind of real causal impact of the food environment on kids' BMI. Neighborhoods are very different. People cite there for lots of different reasons. And so one of the things we're doing is using some city data, New York City Fitnessgram data that the DOE collects, which is height and weight on all New York City public school kids. And we know exactly where where these kids live, and we know where they go to school, and we can kind of follow them over time, right? So what we're going to try to do is a couple different interesting techniques, we hope. One is just look at these kids over time when restaurants open and close in the area, and look at kind of some small area variation, if you will, right? So within, let's say, just census tract A, what if you live really close to this fast food restaurant versus really far away from it, right? What if your walk to school means you pass 3 bodegas versus 5 fast food restaurants, right? Some really kind of real micro sense of what the food environment might look like, with our hope is that it could inform policy in a larger way versus just kind of more versus less stores. So some other thoughts in terms of research priorities and your guide to the next mayoral administration. I think one big solution is, you can read the sentences lots of different ways if you read the parentheses or read the S at the end of it, but we don't yet have all the solutions. I think we are still searching for what one/many solutions are really going to look like, and I think we have to be cognizant of that. I think it's nice to kind of highlight some things that we think are there, but realize we're not completely there all the way yet, and that's an important thing for us to keep in mind. I think we have to really think beyond these kind of traditional policy levers. I think some of the work on on access and on pricing is important, and we need to keep doing it, but I think we kind of have to think outside the box a little bit. I would actually argue that the sugar sweetened beverage portion cap policy was one that really does that, and so I think we do need to think a little bit more about what some of those policies might look like in a non-traditional way as well. I would love to see Susan and the city randomize some stuff. It would make it really fun for us to study it. Let's take one borough and try it first. Let's roll it out, and I had to say it. I think it really would inform our causal estimates of some of this stuff and really give us a much better sense of what happens to some of these policies. And I think the big thing, and I think again, I don't know if Susan's going to talk about some of the shop healthy stuff in the Bronx, but I think we really do need to try a concentration of solutions in the same place, right? Let's not just figure out working on one bodega, but let's do all the bodegas in the area, and let's change the pricing, let's change the marketing, let's do this stuff in the schools at the same time. And I think some of these more comprehensive solutions are going to have to be what we look at. People like me are still going to come in and study the one thing at a time, but I think the real ingenuous thing to do is to really study these things all together, and I think that's important. And I think we have to be really aggressive and also have patience in some of this stuff. It's easy to jump up and down on any one policy and say it works or it doesn't, or what about this or what about that, or to frame things in particular ways. But this stuff is really going to take some time, and I think we have to be ready for that. But I also think at the same time that doesn't mean we need to kind of sit back and say we can't do anything about it now. I still think we need to kind of push as quickly as we can for some of these things to happen on the sooner side. Those are my thoughts. Thanks.